I'm here with Ashley, and Ashley is 6 weeks out from a deep plane face and neck lift, so basically lifting everything from her eyes to her collarbones. We did a trichophytic brow lift where we made a little incision at her hairline, lifted her brows up, and then we did a lower blepharoplasty where we took some of the puffiness out from underneath her eyes. How you feeling, Ashley? You feeling pretty
really good? Really good. I'm super happy and pleased with it.
Yeah. And she looks amazing. I wanted to point out a couple things on her before picture that you can see, and we'll post these as stills in a separate post. But a couple things that you can see with Ashley is she had these big bags underneath her eyes. Now, Ashley, it's interesting because she's 44 years old, and so she's honestly younger than a lot of the patients that we do facelifts on. But she had really started to descend kind of in this area here, and then these bags, they do get worse with age, but they're more genetic than anything else. And so usually when we look at bags, there's not so much an age that you can do it as it is just seeing and noticing and making sure that the fat's there. But like I said, I'm sure you've got family members that have some of those
Yes,
little
I
bags
inherited the bags under my eyes from my dad.
Yeah.
I've had them like ever since I was 15.
Yeah. And I bet you he gave you lots of really, really good genes too.
Lots of great genes, but the bags under my eyes definitely came from him. The lips came from my mom.
Yeah. And she's got amazing lips. So yeah. And so what we did in Ashley's, we went through the inside of her eyelid. We took those little fatty pads out. We transferred some of the fat down into the sulcus and then pinched that up. And then the facelift is incisions that go all the way around the ears. We lift through some connective tissue here in the cheek, so something called the ossicutaneous ligaments, zygomaticocutaneous ligaments. We went all the way through there, lifted everything up, tightened up her jowl, and she's just such a perfect example of really what these procedures do, where you look and she looks younger, healthier, refreshed, and yet just so natural and so pretty. So.
I was telling you before that I've had a lot of people ask me, like, wow, you just look so healthy. You must be feeling so good. And nobody knows that I had a facelift done.
Yeah. It's funny, we hear that all the time, that as long as it looks natural, like you look at it and you can't really necessarily, if you don't know, you can't put your finger on exactly what happened, but you just look so much better. I mean, just like probably 10 years younger. I mean, if we were to look at pictures of you when you were in your mid-30s, this is probably about where you're at now.
Yeah.
So
without the bags.
Exactly. That's right. That happened when you were a teenager. One of the things that we also talked a little bit about today is just that when you have surgery younger, and again, 45 is kind of the young cutoff that we have. We made an exception by 6 months or whatever in Ashley's situation, just because she had descended enough that we felt like, okay, I think this is going to make a big difference. But there's a lot of preventative things that happen by doing a facelift in your mid-40s, in that over time, like it just slows down the rate of descent for really the rest of your lifetime. And so if you had an identical twin, you would totally age differently now compared to your identical twin, just because it stays so nice and tight and lifted. And so there is certainly a preventative component to a facelift that keeps you from kind of continuing down the pathway that you otherwise would have. But in your situation, there were both the preventative aspect that we wanted to address, and then, you know, just obviously lift and sort of create some of what we had done here. So, oh, it's so fun. The one other thing that Ashley and I talked about that I think is important in her situation is that she's just really fair-skinned. And so you can see she doesn't have a lot of natural pigment in her skin. Ashley comes from Wyoming, from kind of the high desert in Wyoming. And the sun's intense there. And so that is ultimately what really damages our skin and just causes descent.
Even with lots of sunscreen.
Still it's hard. Like no matter how hard you try, it's like when the sun is that strong, the atmosphere's thin, the higher up you get, and then just the number of days of sun that you get per year, like it's hard no matter what you do to try and protect your skin over your lifetime. It's just sort of additive. And so I think that's something that also contributes. You know, Ashley's ancestors were probably from like Ireland or Scotland or something, right? Sun doesn't shine there, and so you don't really have to worry about it. But in, you know, high desert of Wyoming, it just ends up sort of cumulatively damaging your skin a lot, and you can see that, I think, contributed to some of that early descent that you had. So
for sure.
Awesome.
Thank you so much, Dr.
I'm so
Bittner.
happy for you. This is so exciting for you. I can't wait to see as you continue to heal and recover, and we'll see you back for a year afterwards, and then as much as you need after that. So
excellent. Thank you.